Women are often bombarded by an overwhelming avalanche of failure rates, hormonal mechanisms, and complex technical features. Focusing exclusively on these clinical specifications creates confusion. This raw medical data can lead to abandoned methods, intolerable side effects, and unintended pregnancies, simply because it ignores the reality of a woman's daily routine. To find a successful method, we have to look past the technical specs and evaluate two interconnected metrics: clinical effectiveness and ease of use. It requires examining a woman's lived reality before looking at the medical device. This chart plots methods by effectiveness and ease of use. Top right are 5-star methods requiring zero daily effort. These include the IUD and implant. Quick insertion delivers years of uninterrupted protection. The IUD's unique advantage is invisibility. Once placed, there is nothing to remember or hide. For women navigating unsupportive partners, or those who require strict privacy regarding their reproductive choices, this invisible barrier offers critical physical and emotional safety. For couples certain they do not want any future pregnancies, permanent sterilization, like a vasectomy or tubal ligation, represents the ultimate extension of this zero-maintenance tier. These highly effective methods act as continuous lifestyle shields. They completely separate the act of sexual intimacy from the ongoing mental and emotional workload of preventing pregnancy. Stepping down to the 4-star methods, clinical effectiveness remains high, but it now depends entirely on a new lifestyle constraint: consistent human behavior. The oral contraceptive pill is highly reliable at regulating hormones, but only if the user adheres to a strict routine, taking the pill at the exact same time every single day. The contraceptive injection stretches that behavioral requirement out. A woman receives a simple, private shot every 3 months, reducing the daily burden while maintaining high efficacy. Women often accept these routine-heavy hormonal methods for the distinct physical advantages they offer, specifically the benefit of predictable, much lighter monthly bleeding and significantly fewer cramps. This reliance on consistent behavior extends into an entirely different biological phase, the postpartum period. For up to 6 months after birth, the breastfeeding method serves as a highly reliable, natural contraceptive alternative. It demands rigorous dication to work. The mother must exclusively nurse her baby, both day and night, without any gaps in the feeding schedule. This continuous nursing triggers a natural physical response, effectively suppressing the woman's ovulation cycle and thereby preventing pregnancy. In this tier, human behavior, whether the strict discipline of a daily pill or the relentless dedication of nursing a newborn, must actively partner with biology. The 3-star methods operate on a different set of rules. They require immediate, in-the-moment action and mandatory cooperation from a partner. Because they must be deployed right before sex, these options see a measurable drop in clinical efficacy. They are vulnerable to human error in the heat of the moment. This vulnerability is why the 2-star withdrawal method carries a high failure rate. Pre-ejaculation fluid can easily leak before the partner withdraws in time. Despite the lower clinical efficacy, 3-star methods remain invaluable for a specific lifestyle constraint. Some women absolutely require their bodies to remain hormone-free, turning to physical barriers instead. Male and female condoms are inexpensive, highly accessible physical barriers that require zero physiological alteration to a woman's natural chemistry. More importantly, the condom possesses a non-negotiable trait. It is the only contraceptive method available that provides critical protection against sexually transmitted infections. This defense is vital for preventing viruses like HIV, as well as HPV, which directly links to cervical cancer. Another hormone-free option is the diaphragm, a small internal cup placed inside the vagina. It offers comfortable protection without interrupting the physical sensation for either partner. Couples may also choose fertility awareness strategies, like the calendar and secretion methods, utilizing detailed biological observation to predict the woman's fertile window each month. This approach requires the highest level of joint commitment. Both partners must be willing to actively avoid sex or use condoms during those specific high-risk days. While these methods lack convenience, they offer unmatched bodily autonomy and disease defense. The safest method depends entirely on what a woman is trying to protect herself from. The perfect birth control is not an objective medical truth. It is a moving target that shifts dynamically as a woman ages, changes partners, and evolves her life goals. That massive catalog of medical data isn't a test she has to pass. It is a highly customizable toolset designed to serve her specific circumstances. True reproductive empowerment only happens when a woman stops trying to bend her daily life to accommodate a medical device. Family planning is truly successful when she simply chooses the science that seamlessly adapts to the shape of her life.